Now we move into the most important part, application. We've already discussed the why, which is the stress shortening cycle. We also learned how to measure it using reactive strength index and eccentric utilization ratio. But none of that is matter unless we can apply it correctly. Program design is where science becomes performance. When we design plyometric, everything come down to four key questions. First, what type of plyometric are we using? And second, how intense should it be? Third, how much volume is appropriate? And finally, how do we progress safely over time? These four decisions determine whether training improves performance or leads to injury. When most people think about plyometric, they immediately think about the lower body, jumping, sprinting, and bounding. But that's actually a limitation in understanding. The stress shortening cycle is not just for the lower body, it applies equally to the upper body. Upper body plyometric include movement like medicine ball throw, catches, and explosive push-up. These are not just strength exercise, they are reactive, elastic movement. Let's break down what's happening. When you perform a rapid stretch, for example, bringing the medicine ball back quickly, you are storing elastic energy. That stored energy is then used to produce a more powerful throw. So the sequence becomes rapid stretch, forceful contraction. This is exactly the same principle we saw in lower body plyometric. Now, when you catch the ball, something even more interesting happens. You absorb the force. That's the eccentric phase, and immediately reverse it into a throw. So now we have catch, stretch, immediate rethrow. This is a true stress shortening cycle in action. And this is the key principle across all plyometric: store, release, activate. You store energy, release it, and activate the neuromuscular system rapidly. Let's look at some example. Overhead throw, you throw, catch, and rethrow. Side throw. This introduces rotational power, which is crucial for many sports. Over back toss and slam, this emphasizes full body power transfer. And finally, plyometric push-up, where you rapidly absorb and produce force through the upper body. Now here's the important takeaway. The principles are identical to lower body plyometric. The only difference is the segment of the body. So if you understand stress shortening cycle in jumping, you already understand stress shortening cycle in throwing. Pause the video, think about it, and ask yourself, how would RSI is reactive strength index apply to upper body movement? Now let's move to lower body plyometric. At first glance, this looks like just a list of exercises, but this is not about memorizing drill. This is about understanding progression and function. All lower body plyometric are built on the same principle, stress shortening cycle. But what changes is intensity, direction, and complexity. Let's start with jumps in places. There are repeated jumps performed in the same location with minimal rest between contact. So what's happening here? You are training reactivity and rhythm. Ground contact time is relatively short, but force demand is still moderate. This is often where beginners start. Next, we have a standing jump. These are maximum effort, but with rest between repetition. So now the goal change from rhythm to max force production. This is no longer about continuous stress shortening cycle. This is about generating the highest output per jump. Now we combine both. Multiple hops and jump involve repeated effort, but with higher demand than simple jump in place. This introduces fatigue plus coordination. Now the athlete must maintain performance across multiple contacts. And bounding is very different. Here, the emphasis shifts to horizon force production. Now we are training speed, stride mechanic. This is highly specific to sprinting. box drill increase intensity by manipulating height. So height equal increase eccentric load. Now the athlete must observe more force before producing movement. Depth jumps, depth jump use gravity to increase intensity. This is one of the most important plyometric exercise. The athlete step up a box, lands, and immediately jump. This is pure stretch shortening cycle training. But here's the key. If ground contact time is too long, it is no longer plyometric. Now let's connect everything. This is not six different exercises. This is a continuum of intensity. If you understand this progression, you can design training. If you don't, you are just selecting random exercise. Pause the video, think about it, and ask yourself, where would you place a beginner athlete in this progression? And where would an elite athlete be? Now let's talk about trunk plyometric. And this is where many people get confused. Yes, trunk plyometric exists, but only under one condition. It must be fast. Plyometric are not defined by the body part. They are defined by the stretch shortening cycle. So if the trunk is not moving fast enough, there is no true stretch shortening cycle. Let's break down what makes trunk movement plyometric. First, the movement is shorter. Second, the transition between eccentric and concentric is faster. And third, there must be a rapid stretch followed immediately by contraction. So the sequence is rapid stretch, immediate contraction. If that timing is lost, it is no longer plyometric. This is where most people make a mistake. Not all trunk exercises are plyometric. Just because you are using the core does not mean it is plyometric. Now let's look at a very common mistake. Many people see this exercise, a medicine ball sit-up, and assume it is plyometric, but it is not. And the reason is simple. It is too slow. Remember, plyometric requires stretch shortening cycle. That means rapid stretch, minimum transition, immediate contraction. In this exercise, none of that happens. The movement is long, the transition is slow, and there is no rapid reversal of motion. So what happened? There is no effective stretch reflex, there is no elastic energy contribution. This becomes just pure strength movement, not a plyometric one. So what determines the plyometric training effect is not the exercise itself, it is the timing of force production. Now let's look at the same exercise but performed differently. Before we saw a medicine ball sit-up that was not plyometric. Now we take the exact same movement but it become plyometric. So what changed? Not the movement, not the muscle, the speed. When the movement is fast, the range of motion becomes shorter, the transition becomes rapid, and most importantly, the stretch reflex is activated. Now we finally have rapid eccentric loading, minimum amortization phase, immediate concentric contraction. This is a true stretch shortening cycle. This is one of the most important concepts in training. We do not classify exercise based on appearance. We classify them based on time structure and force timing. Now let's simplify everything we've discussed. We are look at upper body, lower body, trunk, and even example of what is not plyometric. So now the question is, what actually makes something plyometric? The answer is not the exercise. The answer is the speed and timing of movement. To be plyometric, three things must happen. First, fast eccentric. Second, short amortization phase. Third, immediate concentric contraction. Fast eccentric means the muscle is rapidly stretched. Short amortization means there is almost no delay between phases. Immediate concentric means the muscle contracts right away. When all three happen together, we get the true stretch shortening cycle. This is why a slow sit-up is not plyometric. A fast reactive sit-up is plyometric. Same movement, different timing. We move from understanding plyometric to actually designing a program now. And the first variable we need to understand is intensity. In plyometric, intensity does not mean effort. Intensity refers to the amount of stress placed on muscle, connective tissue, and joint. So this is important. It's not about how tired you feel, it's about how much force your body absorbs and produces. So now what control intensity? Primarily the type of plyometric drill. Think about this. A squat jump versus a single leg vertical jump. Which one is higher intensity? The single leg jump is right. Because all the force is going through one limb. So intensity is largely determined by how force is distributed, how much force must be absorbed, and how quickly that force is applied. Let's look at the key factor that affect intensity, point of contact. The fewer points of contact, the higher the stress per limb. So double leg, lower intensity. Single leg is higher intensity. And speed, the faster the movement, the higher the intensity. Because faster movement increases stress shortening, demand, and force rate. And height of drill, the higher you drop from, the greater the force on landing. Body mass, and external load. The more mass involved, the greater the stress. Now here's one of the most important program rule. As intensity increase, volume must decrease. Why? Because high intense plyometric place a large demand on tendon, joint, nervous system. If volume is too high, injury risk increase dramatically. Plyometric intensity is about stress, not effort. You don't prescribe exercise, you prescribe stress. This connects directly to what we learned earlier. High intensity means faster stress shortening cycle, greater force, higher neutral demand, greater metabolic stress. Pause the video, think about and ask yourself, if intensity is stress, how would you modify an exercise to increase or decrease it? Let's talk about frequency. Most people immediately think how many times per week, but that's actually the wrong way to think about it. In plyometric, frequency is not defined by days, it is defined by recovery time. The general guideline is 48 to 72 hours between plyometric sessions. And why do we need that much time? Because plyometric places a high demand on muscle, tendon, joint, and especially the nervous system. This is not just fatigue, this is a neuromuscular recovery. So if we apply that 48 to 72 hours rule, most athletes will train 2 to 3 times per week. But let's think deeper. Is it 3 times the maximum? It's not necessary. If you manage the time correctly, 4 sessions per week can be possible. For example, Monday, Wednesday, Friday, Sunday. Each session is still about 48 hours apart, so physiologically it works. The body does not understand Monday or Wednesday. The body only understands times between stress. But if you do Monday, Tuesday, even it's only 2 sessions per week, that's too close. Recovery is incomplete. Injury risk increase, right? So now compare this to cardio rest fitness exercise. Cardio can theoretically be done every day. Why? Lower mechanical stress and lower neuromuscular demand. Now let's talk about recovery. And this is one of the most misunderstood part of plyometric training. In plyometric, recovery is not just optional. Recovery determines performance quality. Let's start with rest between repetition. For high-intensity movement like a depth jump, 5 to 10 seconds between repetition. Why so much rest for just one repetition? Because each repetition must be explosive, maximum, high quality. If you rush this repetition, you lose the plyometric effect. And now between set, 2 to 3 minutes of rest. This allows neural recovery, elastic system recovery, phosphochorean resynthesis, so, so that the next set can still be high quality. This is why we often use 1 to 5 to 1 to 10 work to rest ratio. If the work is short and explosive, the rest must be much longer because we are training power, not endurance. This is critical. Plyometric are not cardiorespiratory conditioning. They are power training. If you are breathing hard and rushing between repetition, you are no longer doing plyometric properly. Many athletes make this mistake. They turn plyometric into circuit or conditioning workout. Power decrease, stress shortening cycle efficiency decrease, injury risk increase. Another key rule: do not train the same body area 2 days in a row because tendon need recovery, nervous system needs recovery. High intense stress accumulate. This connects directly to what we discussed earlier, 48-72 hours between sessions. If rest is too short, it's no longer power training. Fatigue kills plyometric quality. So pause the video, think about it, and ask yourself, if your goal is power, should you train while fatigued? Let me show you a very common mistake. This is how plyometric are often presented online. High repetition, short rest, continuous movement. This is not plyometric training. This is cardio, right? Cardio conditioning, not power training. Remember what we learned. Plyometric required maximum effort, high velocity, full recovery. But here, what do you see? Fatigue, continuous movement, not recovery. So what happened? Power output drop, stress shortening cycle efficiency decrease, movement become slower, injury risk increase. This is the key difference. Plyometric training, quality. Cardio conditioning training is quantity. If you are tired, you are not training plyometric, you are training fatigue. Many people think if it looks explosive, it must be plyometric. That is incorrect. Appearance does not define physiology. What defines plyometric training is speed, timing, recovery, not how many repetitions you do. This is why we emphasize 5 to 10 seconds between repetition, 2 to 3 minutes between set, for 48 to 72 hours between session. Pause the video, think about it, and ask yourself, right, is this training improve power or just making you tired? About volume, and this is why plyometric are very different from traditional resist training. If weight training, we think in set and repetition, but in plyometric, we think in contact. And for lower body drill, volume is expressed as contacts per workout. A contact means each time the foot hit the ground. So whether it is single leg, double leg, each landing equal one contact. For bounding drill, volume is often measured by distance not contact. For upper body plyometric, volume is measured as number of throw or catches. Medicine ball throw, chest passes, rotational throw, we count each repetition. Now here is a key point. Volume depends on experience level. Beginner 80 to 100 contact, intermediate 100 120, advanced 120 to 140. And as athletes become more experienced, they tolerate more stress. They control landing better. They maintain quality longer. But remember, volume must match intensity. If intensity go up, volume must be go down. So for example, depth jump, high intensity, need low volume. But jump rope, relatively low intensity, so higher volume possible. So many people think more is better. That is incorrect. More volume without quality is just fatigue. Plyometric volume is measured in contact, not repetition, and quality limit volume. Let's talk about program length. In other words, how long do we need to train to see meaningful improvements? Most plyometric programs typically range from 6 to 10 weeks. Many people assume I need to train for a long time before I see result. But that's not entirely true. Improvement can occur much faster. Research shows that vertical jump performance can improve in as little as 4 weeks. Why does this happen so quickly? Because early improvements are not structural, they are primarily neutral adaptation. In the early phase, motor unit recruitment improve, fatigue rate increase, coordination improve, stress shortening cycle efficiency improve, so performance increase rapidly. But over time, structural adaptation begin to contribute, tendon stiffness increase, muscle properties increase, force transmission increase. So 0 to 4 week neutral adaptation dominant, 6 to 10 week neural adaptation dominant, 6 to 10 week is neural plus structural adaptation. So program length is not just about time, it is about what type of adaptation you are targeting. Early gain are neural, not muscular. Plyometric adaptation start fast but evolves over time. This is why short program can improve performance, but longer programs are needed for durability and consistency. So now we've covered intensity, frequency, volume, recovery, and program length. This is the full framework for designing plyometric training. And pause the video, think about and ask yourself, if improvement happen quickly, how should we structure progression over time? Now let's talk about progression. This is why everything comes together. Plyometric is not just jumping, it is a form of resistance training. And because it is resistance training, it must follow the principle of progressive overload. What does progressive overload mean? A systematic increase in training variables over time, not random, systematic. In plyometric, we manipulate frequency, volume, intensity in different combinations. If there is no progression, the body adapts, stimulus become insufficient, improvement stop. If progression is too fast, stress exceeds capacity. So injury risk increase. So progression is about balance, enough stress to adapt, not so much that it breaks the system. For example, you don't start with depth jump. You start with double leg jump, then single leg, then box drill, then depth jump. This is progression. Over time, you may increase intensity, adjust volume, modify frequency, but never all at once. So change one variable at a time. Progression must be systematic, not random. Overload drive adaptation, but structure prevent injury. This is how everything connects. Intensity, stress. Volume, total load. Frequency, recovery time. Progression, how they change over time. So pause the video, think about it, and ask yourself, if progression is not planned, is it really training? Before we design any plyometric program, we must ask one critical question. Is the athlete ready? So plyometric are high intensity, high stress exercise. If the athlete is not strong enough, they're not ready. For low body plyometric, the athlete should be able to squat at least 1.5 times their body mass. Why is this important? Because during landing, the force can be 2 to 5 times body mass. If you cannot control that force in the weight training room, you cannot control it during plyometric. So for upper body plyometric, bench press strength should be at least 1 time body weight for larger athlete, at least 1.5 times body weight for smaller athlete. This ensures the athlete can absorb force, control deceleration, and produce explosive force safely. If you don't have access to 1RM test, there is a simple alternative and clap push-up. If an athlete can perform 5 clap push-up in a row, they have a sufficient upper body readiness. Plyometric are not just about producing force, they are about absorbing force safely. If you cannot absorb force, you should not produce it explosively. Many athletes skip this step. They go straight into high-intense plyometric. Poor landing mechanic, excessive joint stress, injury risk increase. This connects directly to intensity, high stress, volume, repeated contacts, recovery, tissue repair. Without strength, none of this works safely. Strong muscle and tendon improve force absorption, improve stress shortening cycle efficiency, reduce injury risk. This creates a stable system for plyometric. Pause the video, think about it, and ask yourself, would you prescribe high-intense plyometric to an athlete who cannot control their own body mass? Now let's finish by connecting plyometric to other form of training. Plyometric do not exist in isolation. They must be integrated with resistance training. One of the most important programming strategies is pairing opposite segments. For example, lower body resistance training with upper body plyometric, upper body resistance training with lower body plyometric. This allows one system to recover while the other is being trained. This improves efficiency without increasing fatigue excessively. Another important rule, performing heavily resistance training and plyometric on the same day is generally not recommended because both require high neural output, create high stress, demand recovery. Combining them improperly can reduce performance and increase injury risk. However, there is an exception. Advanced athletes may use complex training. This involves heavy resistance exercise followed by plyometric movement. So squat, jump, bench press, medicine ball throw. This uses a phenomenon called is a post-activation potentiation, where the nerve system become temporarily more responsive. If you look at this weekly structure, high intensity is alternate between upper and lower body. This is the full framework. We start with why the stretch shortening cycle. We measure it using RSI and EUR. And then we apply it through program design. And program design is not random, it is a system. Intensity, volume, frequency, recovery, and progression. So remember this, plyometry is are not just exercise, they are a system. Execution determines physiology. In other words, it is not the name of the exercise that matter. It's how the movement is performed. The speed, the timing, and the quality of execution all determine how the body responds. The same exercise can produce completely different physiological outcome depending on how it is executed. Programming determines outcome, how you organize training over time, the intensity, the volume, the frequency, and the recovery ultimately determine the result you get. It's not just what you do in a single session, but how those sections are structured and progressed that lead to adaptation. So remember, execution determines physiology,